Nights turning into a relay to the bathroom? The stream is slow, you don't feel finished, and sleep never really settles. You're not stuck with it. A handful of everyday habits quietly make prostate symptoms worse, and you can change them starting tonight. Stay with me, change just 2 tiny habits tonight, and you could buy more sleep between trips. In the next few minutes, you'll get 6 simple fixes you can try at home and a 1-week plan to see what actually helps you. Habit number 6 is a tiny label check that saves a lot of rough nights. Everything you're about to hear is built from leading urology guidelines and high-quality reviews, translated into plain English for older adults. My goal is to give you practical steps that fit real life, no scare tactics, no complicated jargon, and no shaming, just clear explanations and what to do instead. Here's how we'll move through it. We'll talk about when you drink, not just how much, so more urine lands in your day, and less in your sleep window. We'll look at why the timing of caffeine and alcohol matters more than people think. You'll learn a calmer bathroom routine that helps you empty without strain. We'll cover why fixing constipation eases pressure down low, how gentle movement and a trimmer waistline can dial symptoms down over time, the common over-the-counter label mistake that can make urination harder, and why a popular supplement isn't your best bet. We'll wrap with straightforward options to discuss with your clinician and a simple week-long plan to test at home. Let's start with the easiest win, the timing of your fluids. Shift more of your sipping into daylight and ease off as bedtime gets closer. For many men, that alone buys longer stretches of sleep between trips. Think less about how much and more about when. When you pour most of your drinks into the daylight hours, there's simply less left to push through your bladder while you sleep. Start nudging your routine forward. Enjoy steady sips with breakfast and lunch. Take your last full glass with dinner, and let the late evening be light. Just small sips if your mouth is dry. What you want to avoid is the big chug trap after dinner or right before bed. That single tall glass can be the difference between sleeping through and getting up twice. Make this easy to test. If you shift earlier and nothing changes in 3 nights, slide to the next habit and keep going. For the next few nights, shift your fluids earlier and watch what happens. Many men notice longer stretches of sleep, less urgency after midnight, and a calmer first trip in the morning. Keep everything else the same for a fair trial, then decide if this timing tweak earns a permanent spot in your routine. If fluids are handled, the next lever is what you drink late, the timing of caffeine and alcohol. Caffeine nudges the bladder and pulls more urine through at the wrong time if you have it late. Slide it earlier in the day so the peak effect is gone by evening. For most men, a simple curfew helps. Enjoy your last caffeinated drink in the early afternoon, then switch to water or a non-caffeinated option. Even decaf has a little caffeine, so treat it like a light version, not a free pass. After a week of earlier timing, many men feel less urgency after midnight and a steadier stream first thing in the morning. Alcohol can be a double hit at night. It's a mild diuretic and it fragments sleep. If you drink, keep it modest, take it with food, and place it earlier. Think supper, not late night. On nights when you want the best sleep window, make it alcohol-free and notice the difference. Pair this with your fluid timing change, and you give your bladder a quieter night to work with. With drinks placed earlier, the next fix is how you actually go, the bathroom routine. Skipping the bathroom until it's urgent teaches your bladder to shout. It also makes it easier to finish with a heavy, not quite empty feeling. Build a calmer rhythm instead. Pick gentle, regular moments in the day to go before the urge spikes, so your bladder learns a steadier pace. When you're there, slow everything down. Rest your shoulders, breathe low into your belly, let the pelvic floor soften, and give yourself a little time. When the stream stops, wait half a minute, relax again, and try once more. That quiet second attempt, often called double voiding, helps many men empty a bit more and start the next hour feeling lighter. If urgency still ambushes you, Practice brief hold-and-breathe waves between trips so the interval stretches gradually, rather than snapping from fine to gotta go now. Keep this routine for a week alongside your fluid timing, and you'll know if the bathroom feels less rushed and the nights a little calmer. If stopping or starting is painful, don't strain, book a visit. Quick pause. If this is helping, tap subscribe for weekly Senior Smart Guides in plain English, practical diabetes, and general health tips for older adults. Back to it. With a calmer routine in place, let's remove pressure from below. Constipation. When the bowel backs up, it crowds the outlet your bladder is trying to use. That extra pressure can make starting harder, shorten the stream, and bring you back sooner. The fix is plain but powerful. Keep things moving. Choose meals that help you stay regular, drink through the day instead of late, and keep gentle movement in the routine so the gut doesn't stall. If you struggle with hard stools or go less than you'd like, ask your clinician or pharmacist about safe softening options that fit your medications. As the bowel settles, many men feel less pelvic pressure and fewer late-night wake-ups. Once the bowel moves, movement itself helps. Let's get the body in on the fix. The bladder pays attention to what the belly is doing. A growing waistline and long stretches of sitting are linked with more urinary symptoms, while regular movement tends to ease them. You don't need a gym to get started. Walk most days, especially after meals, and add light strength work that feels safe for your joints. Over weeks, posture improves, insulin works better, and the pressure around the outlet eases. Many men report steadier flow, fewer nighttime trips, and more control when they keep the body active and the middle in check. Now for the tiny label check that often saves the night. Cold and allergy seasons are sneaky. Decongestants and some antihistamines can tighten the outlet or quiet the bladder muscle in a way that makes urination harder. Before you take a new over-the-counter remedy, pause and read the small print. Look for language about prostate problems, difficulty urinating, or warnings for men with urinary symptoms. If you're not sure, ask your pharmacist for a bladder-friendly choice that won't fight your progress. For many men, this small label check is the difference between a decent night and a long one. Before we talk about next step options, here's a quick story that shows how these changes can play out. Paul is 71 and was up 3 times most nights. He didn't want new pills, so he tried timing his fluids earlier, moved his last tea to mid-afternoon, and walked 15 minutes after lunch and dinner. He took his time in the bathroom and used a quiet second attempt before bed. 2 weeks later, most nights were down to 1 trip, and some nights none. Not every story changes that fast, but his shows what a few steady habits can do. What does help when symptoms persist? When daily changes aren't enough, there are medicines with solid evidence behind them. Alpha blockers can relax the muscles at the prostate and bladder neck so urine can pass more easily, often within days. If your prostate is enlarged, a 5-alpha reductase inhibitor can slowly shrink the gland and lower the chance of sudden retention or surgery over time. For some men, a low daily dose of tadalafil steadies urinary symptoms, especially if erections are also an issue. Every option has trade-offs, so the right plan is the one you and your clinician choose together. Before we wrap, let's clear up a few myths. You may have heard that spicy food makes the prostate grow. The reality is that enlargement and symptoms are tied more to age, hormones, and daily habits that irritate the bladder, like late caffeine or large evening drinks. You may have heard that a bigger prostate always means worse symptoms. In truth, size and bother don't always match. Care is based on the symptoms you feel and the flow you measure, not just on volume. And you may have heard there's nothing you can do at home. In practice, structured self-care, timing fluids, calming the bathroom routine, moving more, and checking labels helps many men feel and sleep better. Now, put it to work with a 1-week plan. For the next 7 days, shift most of your sipping into the daylight and go lighter as bedtime gets closer. Set a personal caffeine curfew in the early afternoon and skip late alcohol so your sleep window stays quiet. Read medicine labels before you start anything new, and ask your pharmacist for a bladder-friendly choice if you need relief. Keep a simple note on your phone with bedtime, wake-ups, and when you drank after dinner. Pair all of this with gentle daily movement and a calmer bathroom routine. At the end of the week, look at your notes. If nights are easier, keep the changes. If not, bring your notes to your clinician and ask about next steps. Time your drinks earlier. Curb late caffeine and alcohol. Keep the bowel moving, stay active, and check those labels. If symptoms still bother you, ask about medicines that relax or shrink the prostate, or about tadalafil if that fits your goals. And if this helped, subscribe for practical fixes that help you sleep longer and worry less. Tell me in the comments which change you'll try tonight, and add how many times you're up now. Your note could help someone else sleep better this week. If you want more practical senior smart health videos in clear language, hit subscribe now so you don't miss the next guide.